Great, good morning. We're excited to be here today to provide a snapshot of childhood lead poisoning in New Hampshire. I'm Katie Bush, the Program Manager for the Environmental Public Health Tracking Program here
live now. Thank you so much.
at the Division of Public Health
We're excited
Services.
to be here today to provide a snapshot of childhood lead poisoning in New Hampshire. I'm Katie Bush, the Program Manager for the Environmental Public Health Tracking Program here live now. Thank you so much.
Sorry about that if people had feedback. I'm Katie Bush, the Program Manager for the Environmental Public Health Tracking Program at the Division of Public Health Services within the Department of Health and Human Services. I'll be co-presenting today with Beverly Drouin, who oversees the Healthy Homes and Environment section with a focus on childhood lead poisoning prevention. The Environmental Public Health Tracking Program is a 100% federally funded program administered by the Centers for Disease Control and Prevention. New Hampshire is one of 26 states funded to participate in this collaborative program. Participating states are shown here in blue, and you can see that all of the New England states are well represented. We're committed to integrating data about the natural, built, and social environment to better understand the connections between environment and health. The EPHT program also focuses on analyzing, visualizing, and disseminating data to ensure that end users have access to timely, accurate, and relevant data that can inform program priorities and drive public health action. Tracking is important because it allows us to conduct population health surveillance, detect unusual trends in environmental hazards, exposures, and health outcomes, identify populations at risk, facilitate policy development, and guide data-driven public health interventions. Funding for today's conference was made possible by a capacity building grant offered by the Environmental Public Health Tracking Program. Both the Greater Nashua Public Health Network and the Greater Sullivan County Public Health Network were awarded these grants beginning in 2018. And I want to commend both groups for moving forward with their projects and activities, especially in light of recent global events. From our program's perspective, it's so exciting that we're all here today attending this conference, and it's a testament to the impact of seed building to really build regional capacity. Coming back to the idea of high quality data, we aim to summarize health data at the neighborhood or community scale in order to summarize trends, highlight disparities where they exist, and drive local action. In just a minute, Beverly is going to share some 2019 lead data for the Greater Nashua region. But before I hand it over, I wanted to make sure that people know where to go to find this valuable data. One resource is the New Hampshire Wisdom Data Portal, and the link is shown here. You can peruse many environmental health topics, and you can click on childhood lead poisoning there in the middle to see lead-specific data. A more local source of data is available from the Nashua Health Department, where they have started to build out their own data dashboards, and the link there is at the bottom. I believe all the slides will be posted after the conference, so I encourage everyone to visit these links and explore the data. At this point, I'm happy to hand it over to Beverly, who will provide an overview of recent policy initiatives in New Hampshire, as well as a summary of 2019 data that provides an overview of childhood blood testing and elevations in the Greater Nashua area.
Good morning, everybody. Hope you're all well. Again, my name is Beverly Drouin, and I work at the Division of Public Health alongside Dr. Bush, Katie, and I oversee the Healthy Homes and Lead Poisoning Prevention Program. So I'm very excited to be here this morning. Nashua, thank you for having me. I want to talk a little bit about some of the policy changes that have happened of recent. So Senate Bill 247 in February of 18 passed, and it had several wins. It had small setbacks, but it had some things in there that I just wanted to talk to you about it. What I tried to do is put them in three buckets: surveillance, action, and funding. So what it did is it implemented universal testing for all 1- and 2-year-olds in our state. So when a child goes for their 1- and 2-year-old well child visit, the physician is required by law to ask that family if they want to get a child's blood lead tested. The family has the ability to opt out if they do want to through a signature. It also required potable testing of all water supplies in schools and daycares, which is a win. Though New Hampshire has very old water supply lines and there can be lead in water, the majority of lead poisoning, almost all the lead poisoning in the state of New Hampshire and across New England, is from the house, from lead paint. But we can't turn a blind eye to what happened in Flint, Michigan, and we would have been tone deaf if we didn't address it in Senate Bill 247. It also required some changes in the action of what the Division of Public Health does. So it lowered the action level from 10 micrograms down to 7.5 micrograms last summer in 2019. So any child who has a blood lead over 7.5, law requires that that child go into medical nurse case management and that the Division of Public Health provide an on-site investigation. That action level this coming summer of 2021 will be going down to 5 micrograms per deciliter, which is CDC's reference level. It also lowered the action level down to 3 micrograms for any child with a blood lead at the point that we notify the parent and the landlord. So we notify the parent and the landlord through a letter through the U.S. mail that has educational fact sheets in there, links on living with hazards and how to live safely in a pre-78 home and where to find resources. It also updated the real estate disclosure law with a stronger definition of what lead is, which was important. And then it also required rental units to test for lead in the drinking water. So anybody who lives in a rental unit, their landlord's mandated to test annually the drinking water. And if there's lead in drinking water over the action level, the landlord's required by law to put in a filtration system. The really exciting thing is it created a low interest loan program that's now run by New Hampshire Finance Authority. Any property owner of a pre-78 house who is income qualified can use this low interest loan, and it's a deferred loan, which is great. And then Senate Bill 247 also mandated that health insurance companies pay for any kind of blood tests, whether it's a venous or a capillary. So Dr. Bush, Katie, her group and my group collaborated on putting together the 2019, we call it the at a glance, but it's the 2019 lead exposure data brief for the greater Nashua region. This is our second year of doing this, and we're going to spend a few minutes here going through this data brief to help you understand how to read it and where to find it online. So let me just find a copy that I can see. Here you go. So the first page of the at a glance has 2 graphs, and it's really all about testing rates. So this graph here in the center, I don't know if you can see my mouse, but the center graph talks about how many children in the greater Nashua region got tested for blood lead. Just over 4,000 children ages 0 to 6. Now remember, we want to test a child at 1 and 2, but if they have not been tested at their third, fourth, fifth, or sixth birthday, they should be tested. So Greater Nashua tested just over 4,000 children, which is 30% of children 0 to 6 years old. Now, 30% doesn't sound awesome, but it's 0 to 6. Remember, we want to focus on the 1 and 2 year olds. So since 2015, that's a 14% increase. You can see the line steadily increasing in testing rates, and that's largely in part the Hitchcock Clinic put in point of care testing and St. Joe's Hospitals put in point of care testing. So it makes it easier for families to get their blood lead test. The graphs on the right are the 1 and 2 year olds. So you can see there's 80% of the 1 year olds in the greater Nashua region are getting tested, and 73% of 2 year olds. So obviously that's an average for the entire region. We have communities in your region that are testing 100% of their children, and we have areas in your community that are testing somewhere in the 56, 57% range. So our average is out. So the second page of the at a glance is the tables. And so what it does is it breaks down all the communities in the public health region, and it helps you understand the data for that specific community. So you can see Hollis, Merrimack, Northeast and Northwest Nashua have the highest testing rates. You have to look carefully at all the columns because it's easy to have perfect testing rates if you hardly have any children. So Northeast and Northwest Nashua, I mean, I'm not saying they don't have children, but you need to look at all the data to understand the story. Pelham, Northeast, Northwest Nashua, and Milford have some challenges with their testing rates. And I see my last bullet's covered here, so let me just find out what the last bullet is. So Southeast Nashua, which I think most of you all know this, historically have the most children with elevations. A lot of rental units, a lot of children under 6 years old, a lot of children living in those rental units under poverty. I mean, I feel that the people in Nashua know the story of Inner Nashua very, very well. So the next thing, and I think Katie's group is really strong in this, they have what they call the social vulnerability indexes, so that you can see all the things that contribute to lead poisoning. So lead poisoning is not really a health issue, it's a housing issue. So you look at the data here on these pages, talk about how many rental units in that area, how many children under 6 living in the rental units, how many families are transient, moving from unit to unit to unit. So it really helps you understand the story. I think that though lead poisoning affects all families, and it has impacted mine significantly, it has nothing to do, I mean, it can affect all income levels. I mean, you can live in the expensive house in the north end of some community high on the hill, or you can live in the rental units downtown, and you have the same chance really of having your child being lead poisoned. So it's a housing issue. And the SVI, the social vulnerability indices, really help paint that picture. So Katie's group enlarged the map here of downtown of Nashua, so you could see the census tracts. What it does is they plotted children ages 0 to 72 months, that's 0 to 6 years old, with elevations that are 5 micrograms or higher. So remember, 5 micrograms is CDC's action limits. This is 5 years worth of data, 2015 to 2019. It's just the trend of the lead exposure over the entire region. And you can see, whenever you see any kind of map like this from public health or CDC, the darker is always the worst, right? The lighter is the better, the darker is the worst. So you can see what type of communities, and they're downtown, they're the tree streets there. So what are we doing to move forward? So Katie mentioned, I think she mentioned that both her group has funded Greater Nashua. In the keynote presentation this morning, you listened to the mayor's representative talk about the community of action. So there's been continual funding going into the Greater Nashua Public Health region for the last 2 years. Environmental public health tracking money, community of action money, and now some CDC lead money. And with that money, the Greater Nashua, or let me back up. So we awarded 12 public health regions across the state. The Greater Nashua Public Health region is just one of them. So we've awarded 12 of them. So collectively, what is Greater Nashua doing? They're building a diverse stakeholders group with advocates across the whole public health region. So it's diverse, it should be representative of housing and code enforcement, health officers, the elected officials, school administrators, healthcare, HUD, public housing, WIC, Head Start, legal aid, property owners, moms. You want it as diverse as you can so you can get everyone's perspective on what the problem is and how the greater community is going to address this. This stakeholders group is going to meet 3 times annually. So if you want to learn how to get involved, we can get you connected. They're going to be providing community outreach to all the partners. All of this, changing something always just starts with education. So they're going to work to educate as many people as they can. They're going to be doing some social media campaigns to address the younger families who really aren't reading print material right now. So many families are getting all their news online, and we want to hit those families. We want to hit the families who are getting ready to buy their first home. My children got poisoned when I bought my first home, and had somebody educated me a little bit back then, my life would have been a tiny bit easier, or at least a little bit different. They're going to be offering some EPA RRP training. So that's renovate, repair, and paint. That's training to contractors who are working in pre-78 houses in lead-safe work practices. So that's everybody from, the people who are renovating your kitchen, swapping out your windows, redoing the deck, repainting the outside of the house. All those people need to learn lead-safe work practices, because more than a third of our children with elevations in the state of New Hampshire have those elevations because they were living in a home that had renovations. So we want to stop that dust from contaminating people. And then they want to look at local code and policy. Changing code and policy is a long game, but they want to, one of the keynote speakers talked about proactive rental inspections. The city of Nashua has proactive rental inspections, and Portsmouth does, Berlin does. So we want to try to get Nashua at a place where, maybe that's not their answer, but that they figure out how to address these pre-78 houses. Because remember, lead poisoning is not a health issue, it's a housing issue. So I've been rambling a bit. Now's the time for questions for Katie and I.
Thank you so much.
If people want to talk about and ask Katie or I.
Yeah, thank you for that presentation. We have one question so far in the chat box, and if anyone else has any questions, feel free to type them in the Q&A section. The question we have right now from Lynn is, can you repeat the year for the home age to qualify for the loan program?
So if you want to learn more about the loan program, I can get anybody the information. It's New Hampshire Housing Finance Authority down in Bedford oversees the loan program. It's a revolving loan program. It's eligible for people who are pre-78. They own a pre-78 property. It's a forgivable loan, which means that when you borrow the money, when you sell your house at the end of, whenever you're selling your house, your 30-year lifetime, that money goes back to New Hampshire Housing. So there's no repayment right now. There's no cost for that. It's for low income families. And I don't know the income eligibility off the top of my head, but I'm going to guess that if you qualify for fuel assistance, that you would qualify for this loan. So, but I think that the conference directors probably can get the name of the grant program out to people if they're not a speaker here already today.
Okay, great. Thank you. Yes, we'll be sharing more information on our website after the conference as well. And it looks like we got another question in the chat. This one is specific to Nashua. It says, does Nashua still have a dedicated person to do in-home education and mitigation? I think that question might be better answered in the panel at the end of the day at 11:10 p.m., where we will have our Chief Public Health Nurse from Nashua on the panel. So unless Beverly...
I can touch on that, Jessica.
Okay, sure.
So any child in the state of New Hampshire who has a blood lead level over 7.5 micrograms per deciliter with a confirmed venous, RSA 130A, which is our state lead law, that kicks in. So that means that someone from the Division of Public Health, one of the environmentalists, is coming out to do an investigation of that property. If it's a rental property, we come out and do an investigation. And if it's doesn't matter if it's a rental or an owner occupied, one of the nurses from the Nashua Public Health Department will come either do a telephonic home visit or do an in-person home visit. I think right now most of the home visits are telephonically, primarily due to COVID, but any child who has over a 15, they would get a home visit. Otherwise, it might just be telephonically. Does that answer the question?
I think so. If there are any other questions or any follow-up needed, please type it in the Q&A box. At this time, don't see any more questions. So we can give it another minute, and I'll just let everyone know we have about 9 minutes until the next presentation. We have a little bit of a scheduled break so that people can get up, get some water, and get settled in for the next presentation at 9 a.m., which will also be on the main stage. It doesn't look like there are any other questions at this time. So I will just thank both of you so much for your presentation, and see, do either of you have any last words or anything else you'd like to share before we conclude? And thank you once again.
I mean, I think we want to thank Greater Nashua for inviting us.
Yeah, thanks everyone, and good job putting together, during COVID and trying out a new platform. So thanks everyone for joining us today.
Yeah. Thank you, guys.
Thank you.